Please join me in welcoming Dr. Bernhard Fassl.
Thank you so much for the kind introduction. I'm going to take you on a journey today, and the journey is called Humanism in Medicine. After I graduated from medical school in 1994, I was pretty excited about life, and I joined as intern a private practice in Vienna, where the general practitioner was getting quite old, and he told me, "Bernhard, you're gonna take over the home visits for me now." So every Friday and every Wednesday, I packed my bag, put my stethoscope, the blood pressure cuff, prescription pad in my little bag, and I started to visit a group, mostly elderly women, to visit them at their home and do a health checkup. Those people were waiting for me too. Many of them actually had a cup of coffee ready, sometimes a strawberry cake, or sometimes I even scored a full meal. They told me about their life, the war, the good times, the bad times that they had while I took the blood pressure and wrote the prescription. After that, I moved on to the next house and repeated it. Now fast forward to 2021, COVID epidemic. I'm at a family dinner. My uncle proudly announces that he no longer will take one of those COVID shots. The only COVID shot he's gonna take is one in his schnapps glass filled with homemade moonshine. When I talked to him and asked him why, he said, I know you guys in medicine, you're well-meaning, but I don't trust you anymore. You guys have become medical technocrats. And don't get me wrong, my uncle is not a healthy guy. He had a heart attack, he has high blood pressure, he's obese, he's diabetes. So the COVID vaccine would be perfect for him, because why would someone not get a shot that is 90% able to prevent death? So I asked my question to myself, how did we get here? And it's not just COVID. Many diseases that we thought of are extinct or not an issue, like measles, they're coming back. People are delivering at home outside the hospital setting because they don't trust the institutions. People accept 19th century medical treatments and accept 19th century medical outcomes, and it's okay. So the question is, what do all these people have in common? And what I found, what they have in common is a complete lack of trust. They don't trust me, the medical system, the medical establishment, what we represent and who we are. This is even harder to believe because medicine truly is the best it has ever been. There's a 50% increase in survival from cancer since the 1970s. 300,000 people who were diagnosed with cancer in 2013 are alive today because they were not born in 1970. That's the population of Cincinnati. We have invented modern medicine. We include human genomics, wearable devices, digital healthcare, artificial intelligence, and we package it all up into a new way to deliver medicine. And we see unprecedented results. What we do today is truly exceptional. Is it? Let me introduce you to my parents. They had a very happy marriage for 61 years until my mom passed away from breast cancer. And it was one of my most memorable experiences as a young doctor when I accompanied her to one of her appointments. Her primary care physician had detected a lump in her right breast a few weeks earlier, so he ordered lab tests, she had a biopsy, she had some imaging studies, and he set up an appointment for us at the National Cancer Center in Vienna, Austria. I went there with my mom, and she wanted me there to help her go through this hard time. So we show up at 10:45, we check in, we're well prepared, fill out a questionnaire, check some boxes, get placed in our room. Then the nurse comes in at 11, she takes the vital signs, asks a few questions, very friendly, very nice. At 11:10, the oncologist walks in and says, "Hi, Mrs. Fassl, I'm so sorry to tell you, but you have invasive breast cancer, and as you know, it has spread to your lungs and it has spread to your lymph nodes. But don't worry, we have a team of experts and we have reviewed all your medical records, we have reviewed your lab results, your imaging studies, and we even know the genetics of your cancer, and we have developed the most perfect treatment plan for you and have summarized it for you in this document." So he handed me a 6-page document. And I was truly blown away as a medical practitioner at that time. It's like, wow, this is top science. Everything is in there. It's amazing. The oncologist concluded, read through this and we'll check in with you in a week through our telemedicine portal. So I was super happy, right? So we left and went back to the car. And then when we were back at the car, I asked my mom, "So what did you think? I think this was amazing. They did such a good job." And her answer was, "I will never go back again." He did not ask me a single question. He did not touch me. And he did not examine my breast. How can I trust what he has planned for me? That made me pause. But it also made me reflect on the fact that there is a profound disconnect what we as medical doctors think is good and meaningful healthcare, and what the patient thinks. I came to realize that we are starting to reduce patients more and more to data sources. There is data that can come from speech. You can get data from the blood tests, from your imaging studies, from your biopsy results, and then magically AI or whatever other computer support is there, you put it together and create a treatment plan. Scientifically impeccable, but we also have paid a price. There's a cost to this. And the cost is humanism. Something is missing. Let me take you on a journey about another profound experience that I had when I was working as a global consultant for a US-based organization in the Nepal government, where we set out to establish a network of small hospitals and birthing centers in rural regions of Nepal. There was significant investment made in infrastructure, equipment, staff, training, and we ended up with really nice places where people can receive care so that deaths associated with pregnancy and childbirth become less. However, the patients didn't come. Those health facilities were not utilized, or not utilized as much as we wanted to. People continued to deliver at home and to seek counsel from shamans and traditional healers before they came to us. So in my frustration, I went to one of those traditional healers to ask, why do the people come to you and why don't they come to us? He said, "You have the watches, but I have the time. I sit down with the patients, I eat with them, and I take their hand when they are suffering to comfort them. That's why they trust me, and that's why they don't trust you." And at that time, I realized that I actually have been acting like a fool. And to this day, I feel ashamed of myself that I forgot about the most important ingredient in patient care, the relationship. I got caught up in academics and research and grants and project proposals that I forgot to build the personal relationship to the people who I set out to serve. What I learned is that trust follows empathy. And empathy is the ability to understand and share the feelings of another person. You put yourself in someone else's shoes, you experience their emotions, thoughts, or perspective. A person who knew a lot about empathy is G.M. Gilbert. He was the chief psychologist at the Nuremberg war criminals trials. He went there to learn more about the psychological structure of the most notorious war criminals that committed state-sanctioned mass murder. He wanted to understand why they became what they were. And what he found is that the only thing that all of them had in common was the absence of empathy. They could not feel with the common man. So now, as I look at how my practice has evolved since the mid-1990s, how much empathy, actually, do I now provide to my patients? How much compassion do they feel I bring across? Have I done really enough to earn their trust? I'm embracing AI, computerized decision support, like every one of you does, and I appreciate its power. But I decided to put it also to the test and ask a question of whether artificial intelligence and computerized decision support can have empathy. So I went to an AI chatbot and asked the AI chatbot, what do you think? So that's the answer that I was given. Computer-driven decision support in AI cannot have true empathy. It can only simulate empathic behavior. It lacks consciousness, emotion, and lived human experience, and therefore cannot offer help based on a shared emotional experience. That's the AI answer. And yet we use those tools to provide support in mental health or social services to people who are struggling without empathy. I want to end this talk with a message of hope and also a vision for the future. And that is that we humans have a very unique competitive advantage that's irreplaceable. And that is that we can deliver care with empathy, compassion, much better than any technology can. It's also a reminder for us to live up to the fact that we have ceded territory. We as doctors have given up a lot of our identity, what defines us as doctors, because we seem to forget about the power of human touch, the power of kind human conversations spoken with compassion. And we have become complacent to agree to dehumanize medical care. Nobody says it better than Dr. Abram Verghese, who is a physician, philosopher, and professor at Stanford Medical School. The world's greatest innovation in the next 10 years, the human hand to touch, to comfort, to diagnose, and to bring healing. And then maybe we can reverse the trend and bring trust back. Thank you.